Prior to legalization, women who were seeking out abortions or being pushed into abortions by others usually found a doctor to do the job for them. And if not, probably somebody else with medical training. Kerneda, for some reason, seemed to have gone to a dressmaker. This is Christina with the Sisyphean Journal, and today is January 28th. Hi, this is the Sisyphean Journal, where we discuss abortion deaths and how they could be prevented. Of course, I would prefer that the abortion never happen. If you don't do the abortion, it can't kill her. But I recognize the fact that sometimes a woman's going to slip through the cracks. She's either going to have somebody in her life who pushes her into an unwanted abortion, or she is just going to be hell-bent on dislodging this unwanted fetus. So let's have a discussion about what we learn on this channel. Now, as I said in the introduction, most women, about 90%, found a doctor to do their pre-legalization abortions. And probably about half of the remaining women found a nurse, a midwife, somebody with some medical training. And even among the lay abortionists, a lot of them did have training. The Jane abortion group in Chicago, although they were all lay persons, they did have training from a doctor. The doctor provided them with medical equipment, drugs, and emergency backup in case something went wrong. That doesn't seem to be the case here. 29-year-old Kerneda was living with her husband, but had gotten pregnant as a result of an extramarital affair late in 1946. So she asked her friend Irene Davis for help. Irene Davis called her friend with the doozy of a name, Ida Rodeffer Davis Kaufman, to make arrangements for an abortion. Now, why Irene knew that Mrs. Kaufman would do abortions, I don't know. I'd love to find out. Like, share, subscribe. I want to get the court transcripts and find out exactly what was going on here. At any rate, sometime around the end of the first week in January of 1947, Kerneda and Irene went to Kaufman's home at Mount Crawford near Harrisonburg, Virginia. Kaufman took Kerneda into a bedroom. When they came out, according to legal records, Mrs. Kaufman told Mrs. Bennett to come back if nothing had happened in 14 days, and if anything was said about why they were there, to say they had come to have a dress made. That's the only clue I found as to what Iva Kaufman's profession was. Say that you'd come here to have a dress made. About 2 weeks later, on January 27th, Kerneda had still not expelled a dead baby, so she asked Irene to contact Kaufman again. The two of them went back to Kaufman's home at about 7:30 on the evening of January 28th. While the taxi was waiting, the two women went in. Kaufman took Kerneda into the bedroom. About 15 or 20 minutes later, Irene heard something fall. And a few minutes later, Kaufman came out to the living room and said that Kerneda had fainted. So Irene went into the bedroom to find her friend lying face down on the floor, moaning. Kaufman seemed very nervous and said that they needed to get Kerneda to a hospital. And I have to give her credit for that. At least it occurred to her to get the woman to a hospital. There are safe legal abortionists who are like, don't take her to a hospital. Somebody might find out we botched the abortion. Well, they're going to find out if she dies, huh? So the women went out and they got the taxi driver to come and carry Kerneda out to the taxi. Now, she was already seeming pretty lifeless when they got her into the taxi. By the time they got her to the hospital, she was dead. Now, that night, Kaufman's house was searched, but nothing of evidentiary value was found. Kaufman told the sheriff that Kerneda had asked to use the bathroom, was shown to the bedroom, had asked for a glass of water, and then had collapsed after taking some pills that she had in her purse. Maybe she took some pills and poisoned herself. I've heard worse excuses. The coroner performed the autopsy, found, I'm going to have to look away from the camera to read this. They found no evidence of external injuries except for a small genital scratch. A piece of placenta was in the cervix and a small blood clot in the vagina, and the uterus was in place. At first, it appeared to be a normal pregnant uterus with no sign of injury. Upon removing the uterus, doctors noted a sensation as if the organ contained air. They opened the uterus and found an intact pregnancy with a fetus of about 3 to 4 months of gestation. So basically what they concluded was that the only thing Mrs. Kaufman managed to do was get air into Kerneda's bloodstream, causing an air embolism that killed her, and then the baby died because his or her mother died. Kaufman was convicted of performing the fatal abortion and incarcerated for 5 years. So let's have a discussion about what difference legalization makes in women's abortion choices, shall we?